Most people think you need dozens of clients to make real money in home care. But what if I told you that with just 10 clients, you could generate enough income to make this a full-time job, as long as you have the right structure? This video is for anybody who's aspiring to be an agency owner looking to start out lean, nurses who are thinking about leaving the bedside, leaving the hospital to run their own shop, and administrative-minded entrepreneurs who want predictable, recurring cash flow from a healthcare-based business. I'll break down two models, both the private pay and Medicaid model, and show you exactly how much you could make with each with just 10 patients. Let's get into it. The first thing I want to talk about are the two typical home care models when you're not dealing with skilled home care. And by home care, I mean you're providing assistance with activity of daily living, companionship, really things that don't require a nurse to be heavily involved or a physical therapist. That falls into the skill category. In this category, home care, we're dealing with just helping people with their daily needs, okay? When you're looking at home care, there are typically going to be two types of payers. You have private payers. Those are going to be paying out of pocket, or maybe they get reimbursed from life insurance, or even they have a long-term care insurance plan that they've purchased way before they had the event. Usually in that market, you're going to charge a little bit more. Why? Because the people can afford it, and it's really consistent with what the real rates should be for this type of service. And looking at the private pay model, most patients are going to pay between $30 and $35 an hour, and you can even get as high as $40 to $45 an hour depending on the market that you're in and the sort of service that you provide. But for the sake of this example, let's just focus on that $30 to $35 range, and I think that rate can hold pretty well nationwide, with the exception of maybe in New York City. You could probably be at $35 to $40, same thing with California. Now, the other payer model that I want to talk about is that is a state-sponsored or the government programs. Now, typically it's going to be Medicaid or a Medicaid waiver program or like a Medicaid managed long-term care program. And there, the rates aren't as good, right? It's because it's state-sponsored. It's supposed to be for low-income families and low-income people who really need the care. And because of that, the price kind of slips, right? As you could imagine. So when you're looking at Medicaid and what they're paying across the nation, you could expect to receive as reimbursement anywhere from $23 on the low end to maybe $30. In some states, a little bit higher on the high end. So again, for the sake of this presentation, I'm gonna try to keep it somewhere in the middle, just so the numbers may be more consistent with your local average. When you're running a home care company, it's very important for you to know what's going on an hourly basis. How much are you making per hour? How much are you paying per hour? But also, how many hours per week are your clients receiving? And you want to get an average of what that count is. Now, you're going to have some clients who are receiving 24/7 care, right? 168 hours per week. Then you're going to have other clients who may only be receiving 8 hours of care per week. In my agency, I really don't like to go below 20 hours per client. And it's just to really make it all make sense for our caregivers. Our average hourly count is around 45 hours, it's like 44 point something, but let's call it 45 hours per week is what our average client gets in our agency. Now, for the sake of this presentation, I'm going to use a 30-hour per week per client average, because I think, again, there's going to be different sort of agencies that use different minimums, and their averages may be different. Now, if you're a company that's going to focus totally on live-in clients, those that are receiving 24/7 care or a minimum of 13 hours per day, your average hours are going to be a lot higher. Now, if we just did a quick revenue breakdown to see how much money you could generally earn with just 10 clients, working 30 hours a week at the average of $32.50 as a private pay model, your annual earnings are going to be $507,000 per year. Now, that's going to be your top line revenue number. That's not how much is going to hit your pockets, right? Because naturally you can have other expenses that you have to pay for. But if you're servicing 10 clients, 30 hours a week, obviously 52 weeks out of the year, you should expect to come in at around that number, plus or minus changes in what's going to happen from week to week. People are going to get hospitalized. They're going to go on vacation. So that's assuming that you service every client every hour for that particular year. Now, comparing that to the Medicaid model, you're going to earn less money, mainly because your billing rate is lower. In the same scenario, 10 clients for 30 hours a week at an average of $27 per hour, your annual earnings will be $421,200 per year. Now, the things that are going to change this up are obviously your contracts with your payers, right? Are you HMO, MLTC, Direct Medicaid Waiver Program, TBI? There are so many different programs out there with different reimbursement rates depending on the complexity of the client. Also, some programs have kind of caps on how many hours they will give per client. I've seen some states only give 14 hours per week per client, 20 hours as the maximum, unless they're in some sort of specialized program. So again, this is going to vary, but if you're just assuming that you're dealing with an entire Medicaid book, average rate of $27 per an hour, this is how much money you would earn on an annualized basis. Now, my company, Passive Workforce, actually consults home care agencies to get them started. It all started with me putting out videos like this, talking about my journey as an 8-figure home care owner. What we've done is put together comprehensive programs to teach you how to go about this. And we also help people who are just getting started out get their licensing together so they're starting on the right foot. I've included some information down below. So if you are interested in getting some help to get started or even learn more about the business, you could definitely get more information on our website. Now you may be wondering, well, I know that private pay pays more than Medicaid, but what are the true profit margins and what can I expect to make as an agency when I'm providing services at this price point? So when you're looking at private pay, you're typically going to be a little higher margin. So your net margin is going to be around 30%, and it can be higher depending on what rate you charge, because the rate is entirely up to you and what the patient will agree to. But if you're looking at our examples here, you'll see that around 30% should be a realistic margin after everything is processed out. Now, if you look at Medicaid, it's going to be lower, and you're probably going to be anywhere between 9 to like 15% on an annualized basis when it comes to your net margin. So you have to kind of take that with a grain of salt, right? You have to realize that yes, you could build out an entire business on Medicaid where the payer is the government, and that could be your entire business model. The majority of our clients fall into that category, mainly because I don't like to shake down sick people for cash, right? And at times there are people who are going to come across financial struggles, and now you have to stop caring on people who really need it just because they can't afford it. I'd rather have the government on the hook and not have that kind of internal issue going on where it's like, well, what do I do with this person's care that I know needs it? You may be wondering how I got to this margin figure. And I'm just using New York's numbers because this is what has been consistent from my agency. So based on New York's staffing cost, mandated HHA wages, workers' comp, OT that sometimes comes into play, and your cost to just run your business and maintain compliance, there is going to be a fully loaded cost per hour to employ somebody. So I take that fully loaded cost and I subtract that from what we earn and what we bill to determine what is our net margin for the service that we provide. To give you a simple cost breakdown, if the HHA's wage was $17 an hour, which it no longer is in New York, it's higher than that. And the payroll burden is usually going to be anywhere between 16 and 20% of a markup. For demonstration sakes, that's going to be $3.50 in this example. You should expect that your back office cost will run you at the smaller size, maybe 10, even 15% of what your revenue is, okay? With that being said, if you're running a Medicaid shop, it's going to affect your profitability because if the margin is 15%, how much is left for you to operate, right? So you have to be conscious of that there's going to be the wage for the worker. There's going to be a payroll burden, again, which is Medicare, your federal taxes, your unemployment taxes, all the taxes that you as an employee have to pay out, plus workers' comp, which is more or less mandated in every state for you to provide. That's going to automatically add cost to your cost basis, okay? So you have to be very careful and know what your margins are so you don't negotiate contracts that are less than what you're actually paying out. Going a little bit deeper, let's compare some of the variables or the factors that are going to come into how you look at your profitability, right? So if you're looking at private pay, using the same numbers that we did before, you're going to earn $570,000. Your actual caregiver wages are going to be $265,000. That's before the payroll burden. You add another $53,000 there. And using about 10 to 12% overhead, you're looking at about $65,000 in overhead to cover rent, malpractice, general liability insurance, maybe your staffing coordinator if you're not doing that yourself, outsourcing to a back office company, utilities. Those are the things that internet, water for you in your office if you got bottled water or a fountain or something like that. They're going to be expenses that you're going to incur just to run your business. Of course, there's ways to bring that down, but just to kind of keep it modest, $65,000 being assigned to that. In that scenario, as a private pay shop of just 10 patients averaging 30 hours a week, your profit point would be $123,000. By comparison, when you look at how it breaks down for Medicaid, you're going to have all of the same expenses. You're going to be forced to be a little bit more lean on overhead. And even then, you're probably going to generate around $45,000, which is closer to 10% of your net revenue. So if you're looking at this, in this example, we're coming close to 30% on private pay, and on a Medicaid model, you're coming closer to 10%. And that's going to be the reality. And it changes as your agency scales up, because as you scale up, you don't necessarily need to get a bigger office space because you're not going to have that many more employees that you're going to need to triple the amount of office space that you have if your census triples. If you go from 10 to 30 clients, you could still manage that with the same exact team. So your overhead will stay the same, but the margin of that you're spending on overhead is going to reduce. Does that make sense? Now you have some control over what you do with your overhead and operating expenses, right? Rent, for example, I recommend starting in a home office if your state will allow it. And if it does not allow it, then get like a co-working space, right? Somewhere where you can get a shared office space where you're paying for your space and that your state will approve. Why? You're not going to have a 3-year or 5-year lease like many commercial leases require. Your utilities are going to be bundled in, your printer, your furniture, right? So you're going to have less startup cost if you start in that co-working environment. Actually, in the very first video that I did talking about expanding my business into Florida, you'll see that I'm sitting in a co-working space for this very reason, right? Because my other offices, we have 5-year leases on. I don't know what's going to happen in Florida at the time that I'm starting my agency. So I want to have that flexibility and I want to keep my costs low. And that's just from professional experience. Another overhead expense that you're absolutely going to have is your malpractice and general liability insurance. Now, it's something that you need to have, so there's not so much that you could do. The best thing that you can do is shop around and make sure that you don't overquote yourself, saying that I'm going to have 100 patients in my first year, because you're going to get charged for that many patients, right? So usually the consultants on our team will guide you on how to go about picking the right general liability insurance and getting the appropriate quote for your first year. Software is absolutely going to be needed. In this day and age, all visits must be electronically verified. That's federal law. We use our internal software called On Time that we license out to other agencies in the adult daycare space, medical staffing, and home care space. So you're absolutely going to need a software that helps you stay organized, allows you to manage your billing, capture your patient notes. Those are all the things that you're going to need. Going about it without a software in this day and age is virtually impossible. Actually, for startup agencies from that 0 to 10 patient point, we only charged $99 per month for. So software is not going to be the thing that drives your overhead at this stage. Next is going to be your phone, your utilities, your marketing materials, right? Your website, your internet expenses, right? These things are going to all contribute to your overhead cost, and you could expect to kind of be paying about $3,000 to $5,000 a month on those expenses, right? If you keep it lean and you have a co-working space, you eliminate the utilities, right? Still gonna need a phone, but you eliminate more or less everything else. Insurance, no way around that. Software is only costing you $99 a month. So in this scenario, you could probably get close to $3,000, maybe even $2,000 if you operate very lean, okay? Because insurance is probably gonna run you anywhere from like $5,000 to $10,000 in that first year, depending on what you elect to include. So right there, that's about $400 per month to like $800 per month on your insurance cost. So that's the only reason why you still might be in the neighborhood of $2,000 after getting a co-working space. If you're wondering what sort of team that you may need, then this portion of this presentation is really going to help you kind of paint the picture of what your organization needs to look like for long-term success. As I stated before, running just a 10-person agency, you could probably do by yourself. if you are fully committed to the idea and you have the skills. But most people who get started are either nurse entrepreneurs or people who are outside of healthcare. So they may not have all the skills. So they're most likely going to have to outsource or hire some of the other support that they may need to run their business properly. Now, if you are a nurse-owned agency, you're going to have kind of a dual role, right? You're probably going to function as the administrator and the nursing director. You're most likely going to do all your nursing visits. Not that much work for you to do on your own, and it's going to be comfortable for you because you're going to know nursing, so seeing patients is not going to be a problem. And kind of leading your organization and taking care of the administrative load, you should be able to handle, okay? Reporting to you would be case managers and other nurses that you might send. Maybe there's certain areas that you don't want to go to or languages that you can't support. So you may have to use a nurse here and there for a visit or to translate, but that's going to be almost fully covered by you, right? You can decide which patients you take. That's your choice. But even if you needed to and you're paying $100 a visit or $150 a visit to have a nurse do an initial assessment just to get the case started, it's kind of a negligible cost. So if you had just a few nurses on your books, that might make some sense. You're going to need schedulers and coordinators. I highly recommend that you outsource these roles. I work with several different companies, so I could get you staff if you need. But this coordinator is going to be dealing with scheduling, reviewing attendance, making sure that the tasks are being marked off as they should for their care plan. And really, I would say early on, you should probably cross-train this coordinator to help with some of the human resource load, such as recruiting caregivers, onboarding of caregivers, because once your cases are stable, there's not much for that coordinator to do. So you might as well maximize on them so that they're doing scheduling and recruiting and onboarding of personnel. And lastly, at this stage, you're going to need somebody on top of your financing. Again, you can outsource this. It's going to help keep your costs and overhead low. We work with a company called Healthcare Back Offices. They will do your bookkeeping. They will do your billing. They can support you even in payroll if you needed them to. And again, by outsourcing that to a company that specializes in that, it gets done correctly, right? So you're not running into billing issues like many startup agencies do. And it takes that load off of the nurse and off of the scheduler. So all the financial stuff is ran clean and neat. Again, not going to cost you that much money to outsource it, but you make sure that it gets done. Flipping this to an admin owner, someone who's not a healthcare professional who decided to own and run this sort of business, there's only going to be one small change. And that small change is going to be them shifting purely into the administrator's role, but needing to hire a nurse if the state requires that, right? Some states don't require you to have a nurse in-house or on your team, even as a home care agency. So again, just look into your regulations for that. But usually you're going to have the administrative non-nurse owner kind of at the top of things, functioning as the administrator. And then you're going to have some nurses on your team to do your case management and your care planning. Okay. That's going to be a fee for service sort of arrangement where you're paying for their hours or you're paying for a visit, again, to keep your costs down. You're not going to want to carry a nurse's salary when your net profit's only going to be $120,000 a year, right? That's going to absolutely eviscerate you, right? So you're going to want to use them on a as needed basis. You have 10 patients, maybe they have to be seen every 6 months. So that's, $1,000 in visits every 6 months, $2,000 of visits a year for their biannual assessments. That might be all you need to pay out, plus a nurse consult every now and then for chart reviews and QA. So you're not going to spend that much money on your nurses if you're kind of set up in this way. Coordinators, again, same thing. Outsource that. They're going to handle your scheduling. They're going to handle some of your HR duties. You as the administrator are going to handle more of those HR duties, those personnel duties. Maybe you get involved a little bit more in the scheduling. So that way, you and that coordinator are working hand in hand. Or you might be someone who has an accounting background and you take on the responsibility of payroll, billing, and bookkeeping, right? So again, depending on your skill set, you could pick up some of these other roles that are on your organizational chart. But I always recommend, if you're going to hire out at this stage, definitely outsource your staff overseas so to keep your prices down. And if you're going to be utilizing nurses in the field and you're not a nurse, hire them on a per visit basis. book them for office hours as needed. It's going to really help contain your cost early on. Outsourcing isn't just for huge companies. What I'm finding are more and more early stage companies in the United States are using outsourcing agencies, right? It really changed how we did business a lot in our agency because there's so much administrative load in medical staffing and home care that hiring local employees sometimes for what seems to be rudimentary work is just very expensive. So to keep your margins healthy, I think it's a good idea, right? You could outsource things like payroll, billing, bookkeeping, right? All those financial services, because math is math everywhere in the world. And there are some agencies that really work purely on outsourcing for the healthcare industry, right? So by working with, home care specialized services, it puts you in a position to get that assurance that even though you're outsourcing to the Philippines, to Africa, South America, the people who are coming into that environment already know home care, already know medical staffing, understand the insurance terminologies, have worked with other agencies, right? I've hired people who have worked with other agencies in the same counties that I service, already know where the neighborhoods are and so on. So that's reassuring, right? So don't be afraid of outsourcing. If you need recommendations, of course, I'm here to help. Now that we've gone through it all, to officially answer the question, how much money can you make with a small agency servicing just 10 clients? You could expect to make anywhere between $45,000 if you're fully Medicaid or charging low rates to about $125,000 per year. And that's all depending on how many hours of service. Again, if you focus on higher need clients that need more hours per week and you had just 10 clients, you could be making 3 times the amount of money, because if all of your clients are receiving 91 hours a week or 13 hours per day as a live-in, in that scenario, what you're going to find is that with 10 patients, your profit margins will triple, even if it's Medicaid, right? So 10 patients, all live-in, Medicaid, you're looking at around 125 grand, right? Private pay, that number is going to skew up to about $350,000, $375,000 on the same patient count, okay? So really you have to be conscious of those factors, those variables. What you bill, how many hours of service are you actually shooting for per client? I've seen agencies make the mistake of taking every patient, regardless of the hours, and it becomes a scheduling nightmare because you now have to recruit somebody to work a 4-hour case 1 day a week, to come in 2 days a week for 2 hours on each day. I don't even touch cases like that. And I recommend that other people don't, because it's going to be a scheduling nightmare. No aide is going to want to get up, get ready, drive to a patient's home to work 2 hours, and then what, right? The aides want to have 40 hours of work per week. So the minimum that we take is 20 hours per week. That way we can at least pair them with 2 clients and get them to a full-time schedule, right? So let's start with client A, commute 20 minutes to client B, and they have a 40-hour work week or 80-hour pay cycle, then they're actually satisfied and fully employed. So that's just another tip from me to you. Really concentrate on the hours. That way you don't run into scheduling issues or issues where you have a bunch of patients, but you're not generating much money. As always, if you like our videos, make sure you subscribe, because obviously we put out videos like this every week so that you could learn how to manage these businesses. And if you need more help, more service, you could always reach out to us directly at passiveworkforce.com or contact us if you need any consulting, coaching, support on hiring staff, or you want to participate in our group mentoring program. We have so much to offer, way more than this. Work with us, and I guarantee we'll help you take your business to the next level. Until the next one, take care.